Hello everyone, my name is Courtney Sappel and today I'll be teaching you about Marfan syndrome. Marfan syndrome is an autosomal dominant disorder discovered by Antoine Marfan in 1896. Antoine Marfan went to visit his doctor to figure out what was causing his elongated arms and legs, and his doctor really didn't have an idea of what was going on, so Antoine was credited with discovering the syndrome. Therefore, it was named after him. Marfan syndrome occurs in about 1 out of every 5,000 people around the world, and 75% of patients diagnosed with Marfan syndrome inherit it from their parents. Patients who have been diagnosed with it have about a 50% chance of passing it on to each of their kids. Marfan syndrome is caused by a defect or mutation of the gene that makes fibrillin 1. This mutation leads to an increase of the protein transforming growth factor beta. The increase in TGF-beta causes issues in connective tissue throughout the whole body, which in turn causes issues such as an enlarged aorta, elongated arms and legs, floppy mitral valve, flat feet, and a dislocated lens in the patient's eye. Sometimes symptoms appear at birth, other times they may take longer to show up. Half of people don't even know that they have Marfan syndrome. If diagnosed earlier, it can be easier to treat. An echocardiogram can be used to diagnose Marfan syndrome, but the rule of thumb test is the Jentzsch test. If the patient has an aortic root aneurysm and ectopia lentis, then Marfan syndrome is suspected. But a genetic test can be used to 100% determine Marfan syndrome as the cause. Although there is no cure, if caught early, Marfan syndrome can be treated with medications such as losartan, a medication used to lower the blood pressure in certain patients. It can also be treated with limited physical activity, routine doctor visits or checkups, and in extreme cases, surgery. With treatment, the patient may be expected to live a full lifetime. However, if the disorder is not caught in time, the patient usually will not live past 45 years. In one specific case, a 36-year-old male visited his doctor complaining of chest pain. The doctor noticed that the patient had long arms and arachnodactyl, or long fingers, and chest wall deformities such as thoracic scoliosis and pectus evacuum. The patient also had mild wheezing, and the reason all of this seemed suspicious to the doctor is because some patients will also suffer from asthma if they have Marfan syndrome, and long arms and arachnodactyl is what Marfan actually had, so it kind of is a little bit of a keynote thing to look at, I guess. The doctor performed an echocardiograph and an x-ray just to rule out any other possible causes, and ended up finding an aortic aneurysm, which is one of the things on Jentzsch's list that basically means Marfan syndrome. After that, he ruled out all other causes and diagnosed the patient with Marfan syndrome. And to try to help ease the patient's pain, he prescribed a beta blocker treatment, but it wasn't really doing anything to help him, so they decided to go ahead and perform surgery on his aorta to try to get it to, get smaller, not be as enlarged. But during the open heart surgery, the patient ended up passing away. I found all of my information through the Marfan Foundation, which is a really good website if you really want to learn more about it. They do a lot of deeper research and have more stories. The case study I actually ended up finding on Northwestern Medicine. They do case studies on other things as well, not just Marfan syndrome. And then Mayo Clinic was where I got all of my diagnostic techniques and the prognosis information. And then Biomed Central's website is where I kind of found all the excess information to throw in as details. So that is everything on Marfan syndrome. I hope you enjoyed this video, and thank you for watching. I look forward to seeing all of yours.